PowerPoint number 10, record completion. Responsibility for completing the patient record resides within the governing body. Now, the governing body are the top ones at the hospital. It also resides with the facility administration, your attending physician, and other healthcare professionals, and of course, the health information department. So the governing body, they're responsible for ensuring that each patient receives high quality medical care and that the care is documented as part of a complete and accurate patient record. Facility administration is responsible for the staff adopting rules and regulations that provide completion of the record in a timely manner. So the major responsibility for adequate patient record, it does rest with the attending physician. So the Joint Commission standards state that the physician must complete a discharge summary that contains reason for hospitalization, findings, procedures, treatment, patient's condition at discharge, and any instructions given to the patient and family. Now let's go with the Medicare COP. Again, Medicare conditions of participation. This is, again, if you don't follow their requirements, you're not going to get reimbursed for any Medicare patients or Medicaid patients. So they're stating that a physician completes a physical exam of a patient within 24 hours after admission or no more than 30 days before admission. And that report shall be on the chart within 24 hours after admission. There must be a medical record entry documenting an examination for any changes in the patient's condition, must be documented in that medical record within 24 hours after admission. The HIM manager is responsible for educating physicians and other healthcare providers and regarding proper documentation policies. They are responsible for keeping them up to date on what they need to document in the chart. So after that chart has been completed, it's assembled, it's been analyzed, providers are notified of documentation deficiencies that need to be completed. Okay, so let's talk about incomplete and delinquent charts. Okay, so incomplete charts is possibly not having something signed, something missing out of it. So how do we tell the providers saying, hey, you need to sign the discharge summary or you need to sign a progress note? Mail a letter or postcard to the office, and anymore in this day and age, it's pretty much going to be email. Inserting that letter or postcard into the provider's mailbox at the facility. They do that. And then lastly, of course, calling them, emailing them about the record deficiencies. So then you have deficiency slips. These can be paper or they can be on the computer. So an analysis clerk will fill out a slip that again can be attached to the record or can be electronically and tells the provider what needs to be completed. So then they are filled in the incomplete record file area, name of the provider, and the patient record number that needs to be completed. Incomplete records. So once all deficiencies have been completed, once all the deficiencies have been completed, the record is stored in a permanent file, or again, electronically. The AOA, Medicare, and JCAHO require that records be completed within 30 days after discharge. And if this doesn't happen, so if that physician doesn't get things signed within 30 days, then they become delinquent. So keep in mind, once they get delinquent, then we go to the next step. Then there's going to be a deficiency report. This list of physicians who have incomplete records to complete with all the patient record numbers and deficiencies with the record. There's also suspension letters. These are mailed to physicians who have delinquent records to be completed. So again, if these are not completed, then they're going to be suspended from admitting privileges, and this happens more than you think. And now that everything's electronic, it is so easy for a physician to go in there and sign or date their progress notes or anything that needs to be completed. But they still A lot of times a physician chooses just that it's too busy of work. So management, we have customized report. This helps with accreditation. And then you can see for more of these report on the Joint Commission. Okay, so let's go in here, delinquent records again. So providers with delinquent records have admitting and surgical privileges suspended until the records are completed. A lot of times they can still work in the physician office seeing patients, but again, if any of those patients they see in the office need to be admitted to the hospital, they can't do it. They would have to have one of their colleagues do it. Again, they review by deficiency reports. They get a suspension letter, and then how many times they then, after that, a customized report. Let's go to the next step. So basically what we're covering here is quantitative and qualitative analysis. Quantitative analysis, this is, I always like to tell students, the quantity. What is being analyzed? You're reviewing the quantity, so you're looking for completeness. So you're looking for deficiencies. So you're looking, is there a progress note? Should there be a progress note? So if there should be, then you're going to check saying, yes, doctor needs to complete a progress note. Or any other missing reports, missing signatures. You don't see a progress note being signed. A history and physical wasn't signed. A discharge summary wasn't signed. These are all deficiencies. This is quantitative. A deficiency slip is used to record chart deficiencies that are flagged in the record. Qualitative. Now we get into the other section, and it's really important you know the difference between the two. Qualitative is the quality of the record up to par. Okay, so we're looking for inconsistencies that would be incomplete or inaccurate, reviewing the final diagnosis or procedures on the face sheet. So when I'm talking qualitative analysis, I'm looking to make sure in one section of the chart, let's say it says right leg, and then another section of the chart it says left leg that they're doing surgery on. That's quality. That's going to affect the quality of the patient, because if they do surgery on the wrong leg, that's going to be a big factor. So what's another quality? Maybe the wrong birth date. Do we have the right chart? So again, those are all qualitative analysis. These all could affect, again, the patient's health. Concurrent analysis. This is review of the patient record during inpatient hospitalization to make sure that the quality of care through quality patient documentation. So we want quality documentation. Statistical analysis is the last one. This is abstracting data from the patient record for clinical or administrative decision making. And again, this is going to be your financial. So again, quantitative analysis, the quantity. It's not going to affect anybody for certain, but again, it's going to make it deficient. Missing signature, missing reports. Where qualitative is some type of documentation error that needs to get fixed, because overall it could affect the quality of care of a patient.